Today, we are excited to welcome Paula Pingel, a distinguished business development executive with over 3 decades of experience spanning healthcare, pharmaceuticals, and digital innovation. As a co founder and business coach, she is currently advising several health tech startups, including MyLua and Dental Fight. Welcome to Health Tech Heroes, Paula.
Thank you very much, Faz. Feel very privileged to be here.
And absolutely 100% my privilege to have you here, Paula, with us today at our Health Tech Heroes. First of all, when I mention heroes in health tech, I really envision somebody like you. So I think it will be appropriate for us to start with an origin story. You have an extensive background in healthcare and pharmaceuticals and health tech advisory space. What inspired your transition from advisory space to be starting startups like MyLua Health?
As you mentioned, I've spent 3 decades doing business development for various companies globally, and I've learned a lot. I have been able to have leaders who allowed me to learn, who allowed me to develop the expertise that I have. And so in going through I've noticed even in setting up my own that oftentimes startups, the entrepreneur has a very good idea. They're ingenious. They can go to their garage and come up with that fantastic solution, but not necessarily the ability to take that from inception to profitability. And so I've honed those skills over 3 decades and thought that, this is what I'm going to do because it will definitely help innovation, help small business owners, and allow me to do something that I am passionate about, which is innovation and bringing products to market. I also am helping NC Innovation and NC Idea here in North Carolina, and I'm helping their universities bring their IP to market. And so it is yet another example of just my dedication to helping small businesses or companies take innovation from IP or inception to the marketplace.
That's wonderful. And double clicking with the NC idea and your current engagement, Paula, can you say what kind of businesses are you helping? What kind of IP ideas that you're currently working on? And is there a niche that you're focusing on at the moment?
Well, it is absolutely a wonderful opportunity to be working with NC Innovation and NC Idea, which stands for Innovative Development for Economic Achievement. And they have been positioned very well by the state, by North Carolina, to bring innovation to market and to make this an innovation state. And so the part that I'm playing, it's huge what they're doing. You have to develop a whole ecosystem and a process for doing that. The part that I'm playing is to help the university, specifically Charlotte based universities, bring their IP to market. So I work with the faculty across many different innovations, many different industries, walk the path of what is needed to commercialize a product and effectively make that product successful in the marketplace.
Can you share some key insights about scaling healthcare innovation specifically?
Yes, for upstream, the solution that we were providing had to be integrated into the clinic or the provider's space. And so it meant that we had to have a very keen understanding of that provider's workflow. And in order to do that, it meant that we had to build those relationships in order to acquire that information. In order to build those relationships, we had to understand the value that we were bringing to that space. And so work was needed to understand what is it, how does what it is that we're positioning to them become a value to them as they perceive it, not as we perceive it, but as they perceive it. What problem is it solving specifically for them? And then creating conversations in a way that can demonstrate that the solution is going to get at that and not only help facilitate their workflow, but also help the community and the underserved. So it's all about very much understanding what it is that is needed for providers and also in the community, and making sure that what it is that you're delivering, that solution, speaks to them from their own individual space and what they individually value.
So that's an amazing insight, Paula. It's not about what you are going to deliver. You have to, of course, know what you're going to deliver, but it's what is their need and understanding. So I think you spent about 80% of your time answering that question, saying that it is what they need and getting into their shoes and really understanding. And once we do understand their problem and their pain point better than themselves, that's where we are able to deliver our products in the best way possible so that it's most
Exactly.
useful. That's a really key point for the startups to realize. One more thing that I noticed at MyLua Health focuses on maternal care and health equity. I would love to understand how is the technology playing a role in healthcare disparities and health equity. I believe you have made a major impact through MyLua in that aspect. Can you double click on that?
MyLua Health is an extraordinary new startup that's still in the development stage and in the pilot stage, where they are building a platform on mobile devices that will allow mothers and pregnant women to just get assistance across the board, whether it be answers to medical questions, conversation with other mothers, or access to providers. It allows them to get that kind of support in a way that is going to enhance, improve their health, and that includes physical and mental health as they go through the process of that pregnancy and even post partum. So it allows them to have quick access and in the meantime collect information and using AI to understand what it is that they're doing, what it is that they're asking for, and who it is that they are, in a way that we can use that information in a predictive way to even help more. So it allows individuals who are underserved, it doesn't matter where they are, to have access to the means that will allow them to have a healthy pregnancy.
How are you helping them, Paula? I feel that you can help them in million pain points, but where are you helping them the most?
I help them where they believe they have gaps. So they will, we meet on a routine basis. I help them not only advising, but I also deliver. So if there's something that they need to understand and spec out, I would pretty much, roll up my sleeves and get to it and say, this is kind of what it is that you're looking for in the direction that you should be going in. So they very much are the ones that are direct what it is that their needs are. And if I see something, chance that I will tell the, but mostly it's driven by what they need and the partnership that we have, just a passion to make sure that this company is successful because it is truly needed um, in the healthcare space.
You have spent some time with GE Healthcare and you spent significant time improving medical imaging workflow. How do you think AI and technology reshaping diagnosis processes today, Paula?
I tell you, I am a huge AI fan. I love it. I'm one of those early adopters. And of course, I guess I would have to be considering the nature of my work. But there is just so much opportunity for AI to help in the health tech space. So, for instance, personalization it will use generative capabilities to understand the patient and therefore be able to deliver specific remedies that is personalized to that individual. It also will diminish variability. So, to make our delivery of healthcare to be consistent and reliable. And I think I know it will also streamline the ability, which is not here yet, but I think definitely coming, streamline the ability for a patient to work across multiple and different providers and for all of them to pretty much know everything about that patient once they walk in. So the dentist is not dependent on that elderly individual to say, yes, here's my medical background. Here's what the medications I'm on. Here's what I'm feeling. Here's what's happened to me in the past. They can, they're able to see that more effectively in a real time, updated way across all different platforms, wherever applicable. And not when I say wherever applicable, I'm not only talking about, in the healthcare space, but maybe even in schools where that kind of background is necessary. Of course, keeping all of the HIPAA and everything in mind, it's, what do you need to know and how do you need to know it? But having all of those checks and balances in place, I do believe AI is going to allow us to streamline healthcare, not only in the provider space, but also at home and in any space that requires that type of assistance.
Are there a couple of examples that you're working on right now you think is going to change the future, is going to have a huge impact?
Well, I am not sharing specific things relative to the individuals that I'm working with, but just even in the space that I am, which is the investor and entrepreneurial space, and looking at and seeing what it is that they are offering. It's cancer, it's enabling the our ability. Right now we are doing well with certain types of cancer, but to be able to provide remedies that are preventative in that space are innovations that are coming down the road. Providing remedies that are more efficient even post diagnosis in that space is just absolutely incredible. Providing remedies around how we manage viruses today and how we not only sustain them so that they could get to any parts of the world, our innovations that are going on today. It is just absolutely incredible the types of innovations that are that have been identified and patented in a way that's coming down the road, that it's going to be just so phenomenal in the healthcare space. So what we have are individuals who are just so good at what they do. I mean, these individuals are brilliant innovators. And then to couple that with AI in a way that it's going to make a procedure that you have today, or even images that you have captured years ago, to just run that through a software that now could pick up details that was not able to be seen by the device or the technology back then. That's incredible. And that's just the tip of the iceberg. So I am definitely excited about the space and where technology is going and where AI is going to take it.
That's incredible, and I think most of the things that you spoke of are the current, and it's happening as we speak. Have you seen within, like, say, last 2 years, changes in what kind of IPs are coming up, without, of course, going into the details of the IP itself?
Significantly, and across all industries. So, NC Innovation and NC Idea are working together to just, maximize innovation for the state. It is across all industry. It's across rail, it's environmental, it's, water. So the type of innovation that it's going to take things out of water that we couldn't before in a cost-effective way. It's being able to use motion devices, AI motion devices in the defense space, that is going to help our military to be more protected, and not only that, but help us to serve them better. It's just, yes, it is just within the last couple of years in healthcare in general. It's just absolutely exponential, and I think it's getting faster. I think the space of innovation in healthcare assisted by AI, it's getting faster, because now it's almost like we're becoming limited only by our imagination. And that's a great place to be, because, people have very good imagination.
No, I think I'm going to steal that our limitation right now is our imagination. So I
Yes.
think it's going to be pretty impressive going forward. You have been a leader in your space, and things are changing so fast. What would be your advice as a leader to just general leadership? What would be the key insight that you'll tell the leaders of companies to think about during this transformation? Is there something that you think is really important?
Definitely, when you're talking about their leadership of people and there's leadership of the innovation. For leadership of people, I definitely recommend, and I've tried to do that. So hopefully I have done the people that I have led well in this area because I really did try to lead them the way I would like to be managed and led. And I think it's going to be more important, especially as we get into this age of AI assisted innovation, to be more mindful of the individual value that uh, that employees bring or that a team brings to the table, and making sure that we're doing the extra work to recognize that and feed it. So the whole idea about a diverse team is that they each bring different aspects of their culture, who they are, how they've lived, what they know, what they've learned to the table. And I think we definitely need to get better at honing that and bringing it out and allowing them to bring it to the table instead of stifling it. When I've done that with teams, we have just, the sky is the limit for us. So I hope that as we move into this era that we do more of that. We do more of the personal touch or personalizing the individuals that are on our team, because there is a risk that they feel displaced by AI, right? So it's making sure that we put not only processes and policies in place, but also have that one on one connection in a way that lets those individuals know that it is, they still have value and that it's teamwork between them and AI and not a substitution. So I think that's going to be even more important moving forward. Relative to the leadership of innovation, it is, and I've seen this already, but it's going to become even more important to lead the solution by being very patient focused, very community focused. Whoever that end user is, be focused on what is it that they're feeling, what is the problem that you're solving for, as opposed to be more in product focused. So historically, especially in the healthcare industry, you will have a device. And what we do is, pretty much develop that device and then say, okay, is the technology advancing over the years relative to what the market demands and relative to what our competitors are doing? And then we will do research and development to get it to that path. I think more so now than before, we are going to the end users to say, what would you like that product to do? And what do you think that product ought to be doing? And not only end users relative to just the patient, but everyone in the chain. So, what is the hospital administrator looking for in a solution? What is the nurse, the radiologist, the technician, the patient, because they all have value that is differently perceived from each other. And whether it is one medical device, you can speak to each of them and you will get a different value perceived from that medical device with each of them that you speak to. So it's making sure that along that entire chain of delivery, you're keeping in mind these different individuals, what they value, and delivering it. So it means that you're going to have to be a lot more collaborative.
One thing that also struck me was that you are bringing it a full circle, where you said our imagination is the limitation at this point. So if you still think about product as this is the product it is going to be, we are actually limiting, saying that this is the limit of the technology, but we do not have that limit anymore. Now we want to find out the problem we are solving, and the technology and your imagination is not a limit, because you can solve that problem because there is no limit to where we can go with the technology. Coming back to a little bit to the healthcare and technology itself, you do have experience with both providers and payers, I believe, Paula.
Yes.
And what do you think will be the biggest barrier to the healthcare innovation adoption? Where do you think the healthcare is going to say, like, maybe this is not for me?
Well, that's a loaded question, right? Because providers and payers are, and when you look across the healthcare as a whole. No one's acting individually, right? There's a chain reaction triggered by many things that are, that we could point to that is making our healthcare system not as optimal as it should be. So for instance, you could look at the payer and say, okay, it's very costly for healthcare insurance these days, and individuals are getting denied claim, and it seems like the cost control is denial of service as opposed to streamlining the delivery of service. So, we had value care there for a while, where we're talking about incentivizing providers when patients are staying healthy. And while those work is still going on, it has slowed down because there's more of a focus on the payer end of how do we keep, tons of revenue coming our way. One of the quickest way to do it is to deny service. And so we need to get away from that. But they're not working alone. They are providing solutions to employers, and employers are saying, listen, I'm only going to be able to pay this much because I can only put the burden on this portion on my employees before I become a place where people don't want to work because the healthcare benefits are just not acceptable. And so it becomes like a chain of, I need you to keep your prices low. It becomes a chain associated with the expense of just getting a procedure, a chain associated with the way we bill patients today in an itemized way, so that there's a lot the transparency across the industry is very much hidden and done so in a way that you really don't understand what the payment is until you're in it, and then you get 5 letters from, for one procedure, one's for the anesthesia, one's for the facility, one's for the procedure, one's for that Tylenol that you got, right? And so it is just crippling to the average American to be able to afford that. And so you see things happening in a way, in a chain, that is driving some of the behaviors that we see today. So I think one of the key things, and many experts will have different opinions on this, in my opinion, transparency will drive the rest. So for instance, making it so that that one bill you get as a patient is the one bill you're gonna get, because it includes everything, allows the transparency associated with what is it costing me, and those hidden costs kind of come out of the woodwork, right? They're kind of hidden there until you get that bill, and now you've had the procedure and you have to pay it. So that transparency of cost, I think, is then going to drive some revelations around why is this costing this, and then that's going to drive some revelations around this can't, this needs to change, and what do we need to do along the whole path. And so I believe that if it starts with that, then that would be a driver of many of that moving forward. But right now, our system, and everyone would say that the healthcare system is very broken, in that while we talk about individual health tech and innovation being able to focus on the patient, the end user, and who you're delivering this to and how they value it, I think holistically, provider, employer, payer, it's not doing that. And so I think once we start getting that type of kind of change in mentality and mindset, then we'll start to see more driven mandates around how we use technologies such as AI to reduce costs in a way that is going to drive lower cost across the board.
I have to wholeheartedly agree with you on that. I think the way we are doing healthcare right now in this country may not be actually sustainable.
Yeah.
Is there one piece of advice that you would give to a brand new health tech entrepreneur?
It is know what you know and embrace what you don't know. So first of all, if you have a solution, if you have a very innovative solution, which more often they do, are you able to take that innovation to where it needs to be to now form this company in a way that's going to be profitable? If you cannot, sit down and evaluate your skill set versus what is needed. And first and foremost, get someone that could say, hey, that can help you do that, because oftentimes we don't know what we don't know, right? If you don't know each of the steps that is needed in order to take a product successfully to market, you may not be able to create that list in a way that is going to be all inclusive. So first thing is to get some assistance that is going to help you pretty much understand what you can do, cannot do, and where you need to get help. And that help does not necessarily have to be, because you're starting up, you can't afford it. It doesn't have to be I've got to hire 50 people. No, you can get that through advisors. You can get that through mentors. You can get that through a lot of different vehicles in a way that will assist you in preparing enough information to go get that additional funding so that you can bring those people on board that are going to help you take it to market. But that's the advice, is knowing what you could do versus what it takes, and filling those gaps in a way that's going to make you successful. I see too many entrepreneurs believing that, oh, well, this shouldn't be difficult. They are geniuses at what they're doing. They could go to a garage and could solve this major problem, and think, well, if I could solve this problem, surely I could take this to market. That's got to be a piece of cake. And then they find out that they can't, because, for instance, one of the biggest hurdles in healthcare is regulatory constraints, right? Or regulatory requirements. And if you are not on top of that, you could find yourself sinking as a small company very quickly. So it's just, you need to understand what you know and what you don't know, and get that assistance accordingly.
I think I'm going to print a t-shirt saying that you know what you know and embrace what you don't know.
Yeah.
And that is an incredible, I think it's going to help me out as well. I think I'm starting with my own business venture. It's such a key information that you need to bridge that gap and fill that gap to be successful. Thank you very much for that. As we come to the end of the podcast, I would love to give you 90 seconds, perhaps more, to pitch what you offer to the wider audience, or any advice. You can take it any direction you want to take it, but the 90 seconds are yours, Paula.
Well, I think it's obvious from your introduction what it is that I do. I have worked very hard internationally to understand what it takes to bring an idea, a solution, a service to profitability. So that is what I do. Uh, what I would like to do is to another just advice for innovators is making sure that whatever you're building and however you're building it, build it with the end user and the solution in mind. Make sure that, and sometimes we start that way, but then we get so excited about what else it can do, and we can start adding things that may not be of value to the space that you started out. So at each step of the way with your innovation, double check to make sure that you're solving a real problem that exists, and not ending up with something that is, a nice to have, but it's not solving a real problem, because that is going to very much determine your attachment rate.
Thank you very much, Paula. And this brings us to an end to our podcast today. And I cannot appreciate enough the privilege of having you over as a guest at our podcast. Thank you.
Thank you very much, Fazil. Really appreciate the opportunity, and it was great speaking with you today.
My pleasure.